everyone. I'm Heidi Murkoff, and if you're pregnant or love someone who is, you have come to the right place. Not only to celebrate our 10th annual Bump Day, which is coming up on July 24th, but to talk about something every mom and her partner needs to be aware of and alert to and empowered to speak up about the signs and symptoms of serious pregnancy and postpartum complications. What's normal and what's not, because knowledge is power. So I'm excited to be joined today by maternal health champion, Dr. Lisa Hollier, who has made it her mission to help moms have safer pregnancies and safer births. She's senior medical advisor of the CDC's maternal mortality prevention team, and she is here to talk about those urgent maternal warning signs and one of my favorite public health campaigns of all time, Hear Her. Welcome, Dr. Hollier.
Thank you so much for having me here with you, Heidi. I am delighted to be here. As you mentioned, I have spent much of my career working to help moms have safer pregnancies and births. CDC's Division of Reproductive Health is committed to healthy pregnancies and deliveries for every person. The Hear Her campaign really supports CDC's efforts to prevent pregnancy-related deaths by raising awareness of urgent maternal warning signs of potentially life-threatening complications during and within the year after the end of a pregnancy. It also encourages support systems and healthcare professionals like me to really listen to the concerns of people who are pregnant and postpartum. I am absolutely passionate about the Hear Her campaign because I believe that patients, families, clinicians, and communities all working together can improve health outcomes. The Hear Her campaign features compelling stories from women about their experiences during and after pregnancy. They share how pregnancy-related complications or conditions affected them and how they got help. Printable materials for moms and their loved ones are also available in about 27 different languages.
Wow, that's great. Oh, goodness, I didn't even know that. That's incredibly helpful. I have to say, I know you're passionate about Hear Her, but I may be Hear Her's number one fan of all time. I love this campaign because it's so simple and it's so perfect. Because every woman should be heard when she speaks up. And I know you've produced all of these resources and in 27 languages. I didn't know that. That's incredible. We've been sharing them on what to expect as fast as you can produce them, and I tell everybody about it. But what are some of the most serious signs of a pregnancy or postpartum complication that all women should be aware of, all moms should be aware of, just in case, not because they're going to experience them, but because, again, knowledge is power.
Absolutely. Knowing what to expect is very important. Some of the serious symptoms include having chest pain or a feeling of tightness or pressure in your chest, or having a fast beating heart or irregular heart rate or skip beats, all of which can indicate serious problems with the heart. Trouble breathing, whether it comes on suddenly or over time, the feeling that you can't breathe deeply enough to get air into your lungs can be a sign of heart problems or lung problems. Another important symptom is severe belly pain. That can be a sharp or stabbing pain that occurs later in pregnancy, or lower belly pain very early in the pregnancy that can happen along with severe shoulder and back pain. Severe swelling, redness, or pain in one of your legs may indicate a blood clot. The Hear Her website provides additional descriptions of these and other urgent warning signs.
So I just want to be sure to clarify that most pregnancy symptoms seem like random, like, whoa, what is happening to my body? And yet, um, some can be very sort of very close to the symptoms of a complication. So, for instance, when you're pregnant and you're getting bigger and bigger and you're carrying around that load of a baby in uterus, then sometimes it feels like you're out of breath. But this is a different kind of out of breath. Or you have a sharp pain, in your pelvis, and that we sometimes fondly call light lightning crotch, right? But it could be something to laugh about, but not if it's a pain that continues. That's the kind of pain that just comes
Right.
on and then goes away quickly. So I think it is important to keep that list close by so you know what symptoms you're talking about. And say you're not quite sure, because my mommy mantra is always, when in doubt, get it checked out. Because mom gut it's not 100% reliable, but a woman knows her body better than pretty much anyone else because she's lived in it her whole life, right? So, say that a symptom doesn't quite neatly fit into that list of warning signs, but your mom gut is telling you something isn't right.
Your mom gut is important. It's important to trust your instincts. Each person knows their own body better than anyone, and they can often tell when something just doesn't feel right. The most important thing to remember is that anytime you feel like something doesn't feel right, talk to your healthcare provider right away. There is no question that is too small to bring up. We also want to encourage partners, friends, family, coworkers, providers, anyone, everyone who supports pregnant and postpartum people to really listen when she tells you that something doesn't feel right. Don't just dismiss the concerns as being normal for pregnancy. Encourage your loved ones to talk to their healthcare provider about anything, any concerns that they might have, things that just don't feel right.
Exactly. And as they said, pregnancy comes with so many strange symptoms. And, most of them I actually wrote a book about it. That's how many symptoms there are. And most of them are part of the pregnancy and postpartum package. But when a woman speaks up about a symptom that she's having that's worrying her, and we've established that she should speak up, what if her concerns are dismissed? What if they're brushed off and her provider, when she does call, or the nurse who answers the phone, says, "Oh, that's normal. Oh, that's normal." What does she do then?
Well, Heidi, we've, like, as you said, we've talked about how important it is that if a mom feels like something isn't right, or if they're just unsure whether or not it's serious, they should talk to their OB or their midwife. This gives the clinical team the chance to evaluate the symptoms within the context of her specific situation. So, if you're seeing a healthcare provider that you haven't seen before, as a mom, be sure and tell them you are pregnant or were pregnant within the last year. Describe any other health conditions like high blood pressure or diabetes, along with any complications you experienced with pregnancy or delivery. If you can, bring a friend or family member to help support you and help you ask the questions that you need to have answered. Some moms find it helpful to bring our printed materials with them to show their OB or their midwife. Um, the printed materials have some instructions like, um, I've I've learned about these warning signs, and I've been having swelling of my hands and face for several days. You can find this conversation guide on our website, and then you can print it and take it with you to see your OB or your midwife.
That's great. And because, all moms expect to have some swelling, especially of their ankles and their feet, and the shoes get a little tight, maybe the ring on your finger is getting a little tight, and word to the wise, you should probably remove it before it becomes too tight. But when it comes to swelling that's new, unusual, maybe you've suddenly put on a lot of weight, or you're having concerning symptoms that are accompanying that, like, for instance, blurred vision or headaches that won't go away. So then, if you have several of these symptoms, especially, but if they're out of the usual for you, and not all swelling is normal swelling during pregnancy. I wanted to ask, because one of our What to Expect community moms asked if there's a way to prevent perinatal mood and anxiety disorders and like postpartum depression. Women are starting to talk about it more, which is a great thing. Um, but that concerns them. What are my odds of having postpartum depression? Um, so while that's an important conversation on its own, what's some advice you can give to a mom who's experiencing some signs of depression or anxiety, OCD? What should she do?
Well, Heidi, anxiety and depression before or after pregnancy are very common conditions. While there is
Hmm.
still a lot to learn about the causes of these conditions, the best thing that you can do is talk to your loved ones, talk to your healthcare providers about the concerns you have and the changes in how you're feeling. There are many resources available to support pregnant people, pregnant and postpartum people with anxiety and depression. And it's really, really important to know that you're not alone when you're going through this. I recommend doing your best to keep your social connections with your friends and with your family and ask for help when you need it. It's important to take care of yourself. Eat well, stay active, take some time to rest. And as a mom, I know that this is a lot easier said than done.
Yes, that is for sure. As a mom, I concur with you. Um, but I always say sometimes being strong means asking for help, and that especially when it comes to a perinatal mood and anxiety disorder. I feel like moms have this compulsion to be stronger than anybody else in the room or anybody else on the planet. We're mom strong, and we are strong, but that doesn't mean that you shouldn't ask for help when you need it. And so I totally agree with that. um, Now, you see a lot of moms in your practice and over the years. Is there a specific story about a patient that you'd like to share that highlights how important it is for every mom, no matter what her situation, gets the support that she needs and deserves, and why every mom does need to be heard when she speaks up?
Heidi, we've heard way too many heartbreaking stories of women, particularly Black women, who knew something wasn't right with the pregnancy and voiced it, but were
Mm,
not heard, and
yes.
unfortunately have died as a result. I wanted to talk briefly today about CDC's own Dr. Shalon Irving. She was one of these women. Shalon was a lieutenant commander in the United States Public Health Service. She
Um,
was an advocate for eliminating health disparities. In 2017, she died just weeks after delivery due to high blood pressure, despite continuously visiting her providers, where she kept insisting that something was wrong and being dismissed. Her story, plus many others, remind us why it's so important that we do this work.
Absolutely. And she, as a physician, had her mom gut plus her medical training to know that something was wrong and was still dismissed, as many women of color are. And uh, that's just unacceptable. I completely, and that's why when someone doesn't listen, you have to speak up and speak up again until you are heard. Um, I've often said that there should be a hear him companion to hear her campaign. And I know that you're targeting more resources to dads too, who can, I, I am convinced they can be the best advocates for their partners in their health and well-being and their baby's health and well-being. So how important is it that women share the list of urgent maternal warning signs with their partner.
Partners and spouses are incredibly important on the pregnancy and postpartum journey. In
Yeah.
fact, we recently hosted a Reddit Ask Me Anything event with several dads from our division in hopes of reaching male support people in
Mm,
particular.
yeah.
Sharing that list, Heidi, of those urgent maternal warning signs with family and with friends is also very important. As you said, your loved ones are often your strongest advocate and accompanying you to the doctor's visits or the midwife visits, helping you voice your concerns with your healthcare providers. And it's really, it's really important to have open and honest conversations about how you're feeling with those people who are supporting you.
Absolutely. And it's also important that providers hear him, when he does speak up, to engage them in all the prenatal care and, and postpartum care, but also that their voices are heard, because often, especially Black dads, are not, and they have a lot to say about their partners, and they are invested in their partner's health and well-being and their baby's health and well-being, and all the evidence backs that up, so we should hear him. In the spirit of Bump Day, which I love, my favorite day of the year, what is one thing you'd like every mom to know about how to have a safe pregnancy and a safe birth and a healthy future for herself and the baby that she loves?
I think if I could only pick one thing, it would be having people know that there is no silly question. You know
Yes.
your body best. Pay attention to anything that feels off or is worrying you. Your healthcare providers are there to support you and to discuss all of your concerns.
Absolutely. Amen. Preaching to the choir. That's for sure. Um, so thank you so much for joining us today, Dr. Hollier, and the work you're doing to help empower moms and dads is so very important. And I love that we share that mission. So thank you again. And I also want to remind everyone that this year's Bump Day is on Wednesday, July 24th. So get ready to share your bumps, past or present, yours or one love, or a video story or message about your birthing journey with the hashtag Bump Day on social media. Big hugs to you, Dr. Ollier, and I will see you on Bump Day.